On small ambulatory clinics and the program, we included $15 million in the omnibus for the small ambulatory clinic program. This was built on funding that we provided for the first time in FY17. Well, it wasn't the first time, but it was the first time since '08. This has been a very important program in some of our smaller villages, as we've seen tribes in places like Tooksuk Bay, Chiniga, Cake, Hooper Bay take advantage of that. Can you tell me how many proposals you received for funding through the small ambulatory clinic program, and if we've got any updates with regards to awards for the programs and how funds might be allocated going forward?
Thank you, Senator, for the question. And we did receive 20 applicants when we did the solicitation based on the FY17 appropriation. Considering when the resources came, it was late in the year, and we decided for the amount that we had there, we would, depending on what happened in FY18, and thank you again for those resources, we merged the two for the $20 million to be available for the distribution. And after an objective review team, of which there were no members from any area that had submitted an application. So we completed all of that, and all of the recipients of the awards have been notified. That was notified either late last week or early this week. And I'll just quickly run through the numbers. If you want later, I can give specifics as to the location. And there was no representative from the Alaska area nor Albuquerque area on the review team that did this. Alaska has 5 recipients that will receive this. One of them will be partial amount because of the total amount we're not able to get to all 5 in Alaska. New Mexico has 3, and then we go California 1, Utah 1, Arizona 1, and Washington State 1. And that accounts for 12 of the 20 applicants that will receive resources. And then,
well, let me ask the question, because you had submissions that clearly indicate that this is a valued program, and yet the budget request doesn't include any funds going forward in FY19. What's the rationale for not funding the small ambulatory clinic program?
The small ambulatory program is part of the appropriation under the healthcare facility construction line item, and as you note, it has significantly been reduced, and that is consistent with our desire to maintain the high level of the high priority for healthcare delivery, and that's always been the case over the many years of facilities. But once again, we really want to thank you for the inroads we've been able to make with the increases in FY18.
Well,
and why did we put the $79.5 million into the 2 projects that are identified on the list that we've requested? And the reason is one of them will complete the quarters for the DILCON project, so we can, if we get those resources, we will then proceed forward with a contract to get those constructed. And then the other $20 million will be to move along as we get further into the design for Pueblo Pintada, that we will be able to then move toward construction.
Well, know that when we see programs like this that are designed to help, again, some of these very small clinics in very remote areas where healthcare options are simply not available. It's this or nothing. Know that I'm going to continue to place a priority from a budget perspective. This is the beauty of being on the Appropriations Committee and being able to set these priorities out there. But when I look at what you have done in other areas of the budget to reduce funds for whether it's the facilities construction and the maintenance accounts, and then I see good programs with clearly a level of interest that is making a difference in these smaller communities. I'm concerned that we are once again shortchanging the IHS system. We haven't really talked about the shortages that we face in the healthcare workforce, but I would contend that when you have subpar facilities, places that not only people don't want to go for their care, but no provider wants to work there, it's really difficult to do right by the men and women that we're serving and their families. So I'm going to keep fighting for the small and ambulatory clinics, and would just encourage you to work with us on some of these priorities. I'm well